It's Wednesday, May 13. This is the news on PBCJ. I'm Carol Francis. As of Wednesday morning, 100 Jamaicans have recovered from the coronavirus COVID-19. The health authorities reported that 10 additional individuals have been released from care. On Tuesday, the island recorded 2 new confirmed cases, bringing the total number to 507. The Health and Wellness Ministry reported in a news release. Simone Absalom has more in this report.
A statement from the Health Ministry says one of the 2 cases is a female, aged 57 years, and the other, a 6-year-old male. They are both from Kingston and St. Andrew and are contacts of confirmed cases. There are currently 192 cases that are contacts of confirmed cases, including 95 that are contacts of employees of a workplace cluster in St. Catherine. 224 cases that are employees of a workplace cluster in St. Catherine. 26 cases are under investigation. As at May 10, approximately 3,022 people from the quarantined communities of St. Mary, namely Onoto Bay, Dover, and Enfield, were assessed. 84 samples were taken, with 66 results received. Of those 66 results, 2 were positive and 64 negative. 18 results are pending. For the news on PBCJ, I'm Simone Absalom.
To alleviate the economic pressures brought to bear on ordinary Jamaicans by the COVID-19 pandemic, the government made compassionate grants available under the COVID-19 Allocation of Resources for Employees or CARE program. More from Gabriel Thompson.
CARE program compassionate payments were released on May 7, and since then there has been a run on remittance companies across the island. In the corporate area, thousands of Jamaicans have been huddling in queues for hours on end, with all protocols on social distancing thrown out the window. Chairman of the Special Select Committee of Parliament on Public Health during this COVID-19 crisis, Health Minister Dr. Christopher Tufton, addressed the issue at Tuesday's meeting.
It's a matter that has been discussed at the highest level, at the cabinet level. There have been some adjustments made, recommended, and some made. For example, today, for the KSA area, the Western Union organization has been relocated to the national stadium using a series of windows. Persons have been referred, or the excess capacity have been referred there. I think that is going on as we speak. With health has been present. I've dispatched a team there to work with them to help to manage the social distancing issues and minimize or mitigate against the potential risk. Elsewhere in the country, the health authorities have been asked to communicate with the particular private sector entity to coordinate and to assist with some of that, crowd management, if you will.
St. Andrew's Southern Member of Parliament, Mark Golding, said there are identification issues for some of the claimants.
ID issues as well, Chairman. Persons who don't have their voter's ID for whatever reason yet, it hasn't been issued or whatever, or they may have lost it. Is there any alternative way that they could be identified for the purpose of collecting their grant? Can a letter from JP suffice, or from their MP or councillor? Some flexibility around these issues. These are real problems on the ground.
I'm going to ask that we raise that with the minister with direct responsibility later on.
For the news on PBCJ, I'm Gabrielle Thompson.
Finance Minister Dr. Nigel Clark updated the House of Representatives on Tuesday regarding the government's CARE program. He says the government has received over 500,000 applications for the grant.
So far, Mr. Speaker, approximately $2.65 billion in compassionate grant payments for some 265,000 applicants, or 70% of those eligible, has made its way to financial institutions, the financial institutions selected by applicants. And there were over 40 financial institutions available in the categories of deposit-taking banks, credit unions, of which there are many across Jamaica, and remittance companies. The remainder, Mr. Speaker, the difference between the 265,000 and the remainder who are eligible are being processed, including being processed for the validation of banking information.
Dr. Clark said many persons selected to receive their compassionate grant from remittance companies.
We had a total of 401,314 compassionate grants, of which 210,000 applications sought a commercial bank avenue of payment, 162,000 sought to be paid through remittance entities, and 29,000 sought to be paid through credit unions or billing societies. Of this total, Mr. Speaker, approximately 378,919 were deemed eligible, and 22,395, or 6%, have been determined to be ineligible due to the fact that they are on a recent payroll.
The minister also said he has written to the Auditor General and invited her to independently review the application and disbursement process of the CARE program.
Given the unprecedented size and scope of this social intervention program, Mr. Speaker, and the speed with which it has been designed and implemented, and the desire for transparency nonetheless, I wrote to the Auditor General and invited her to independently review the application and disbursement processes of the CARE program. The Speaker tabled the first report on the application system last Tuesday, and processing of compassionate grant payments only began after this report became available to the administrators of the CARE program.
The CARE program started making compassionate grant transfer to financial institutions, and these have been made available to applicants from May 7. Improvements have been made to reduce the wait time and lengthy lines in the disbursement of compassionate grants in Kingston. People who selected GKMS Western Union to receive their compassionate grants under the government's CARE program are to begin receiving their disbursements at Mass Camp in Independence Park and at the National Arena in Kingston. Marlon Samuels has more in this report.
The large crowd, long lines, lengthy delays, and lack of adherence to social distancing rules when many Jamaicans tried to collect their care benefits sparked major concerns. The government quickly stepped in to provide a safe, comfortable location for them to receive their money.
We see all the pictures of the crowds. I never like it because in the COVID time, crowds mean that you have a whole set of people who could be infected. So we put in place these new measures. Hopefully, it will take off some of the burden of the other remittance offices.
Mass Camp was selected after GKMS Western Union outlets were unable to process the large number of beneficiaries while practicing social distancing.
I convened a meeting between officials from the Ministry of Health who were sent by Dr. Tufton, Minister Tufton, along with the Independence Park staff and the Grace Kennedy team, as well as Colonel Rickman from the Hope Program, who is providing manpower to assist in screening, pre-screening the applicants who are here, and also to help in the management of the crowd. What I'm happy about is that Grace Kennedy is also making available a team that will open bank accounts for these persons. And it is important that Jamaicans recognize they need to have a bank account, they need to be in the system, they need to have their TRN, they need to have proper identification. They must enumerate so that they can have their national ID and be in the system so that they can benefit.
Tents have been erected at the car park to provide shelter for the care beneficiaries, so too hydration, sanitization, and medical stations.
The CARE program is what the acronym says. The government cares about people. And the funds that are being made available to these people is to assist them in this time, this challenging period of COVID-19. And it's extremely important that in receiving these contributions, they also receive it in an environment with dignity.
Measures have also been put in place for the more vulnerable among us. Those who are pregnant and at risk of severe illness from the coronavirus COVID-19 can collect their care allowance at the National Arena in Kingston.
The National Arena will be used to facilitate the elderly, pregnant women, and the persons with disabilities. So they'll be indoor and they will be seated, observing social distance, as well as when they queue up to receive their funds, social distance, we will be marking the area so that social distance is observed. Proper sanitizing will be in place, water stations, hydration stations.
So please wear your mask. Do not remove the chairs, all right? Good morning. God bless you, no. Me love you, no. Behave yourself.
For the news on PBCJ, I am Marlon Samuels.
Over in St. Thomas, there were scenes of chaos as scores of citizens descended on the Western Union outlet in Morant Bay to claim their compassionate grant from the government. Again, there was no consideration for social distancing. One of the more vulnerable groups to COVID-19 is the elderly. They too could be seen in the crowds.
They should have a place for older people and younger people in line. They don't line up right. It don't sound good. It's not right. It's not right. It's not right. The younger people should be one side. The older people are one side. Everybody can bungle up here, so that's not right.
The police were forced to intervene to create some semblance of order.
That's all I am doing. So I need the people to move off of the concrete so we can start giving out the number. So the men who think they are strong, get the people off of the concrete and form the line. That's all I'm doing.
Justice Minister Delroy Chuck wants a single oversight body for all commissions of Parliament. He made the case as the House of Representatives debated a motion to set up an oversight committee for the Integrity Commission.
If this oversight body, which has now been put into the standing orders committees, whether we shouldn't look at one oversight committee for all commissions of Parliament. You see, we can't have oversight and oversight and oversight. I have no problem in that this body which we are now debating should be the oversight body to look at reports and ask questions of the commissioners and so on. But we just want one body to look at all the commissions of Parliament. You can't have this body which we are now set up and there's another oversight chaired by the Speaker. No, something is amiss.
Opposition leader Dr. Peter Phillips agreed that there must be oversight of all the commissions of Parliament. He said the House will have to examine the best mechanisms that could be put in place.
I don't think it would be advisable for us to put all of these commissions into one entity. An effort was made, I believe, in the administration of 2007 to 2011. To have a committee established to receive reports from these commissions. But if truth be told, it never lived up to the expectations nor the hopes. But there must be oversight. There must be oversight. So we have to examine the best mechanisms. But I think that in this particular instance, the Parliament considered it important, given the powers given to this commission.
Other public entities report directly to the Parliament, including the Office of the Director of Public Prosecutions and the Electoral Commission of Jamaica. The Oversight Committee for the Integrity Commission is to be chaired by the Justice Minister. The mobile unit of the National Health Fund, NHF, is in the quarantine areas of St. Mary, filling prescriptions of persons who are in need of that service. The NHF is the subsidiary of the Ministry of Health and Wellness that is authorized to deliver prescription through the DrugServe platforms. Minister of Health and Wellness, Dr. Christopher Tufton, gave an update with the times of operation for the quarantine areas in St. Mary during a digital press conference at Jamaica House.
as it relates to medication. The National Health Fund, which is the agency of the Ministry of Health and Wellness and government authorized to procure and deliver through our drug serve windows. They have mobilized. In fact, I was there on Saturday and saw the mobile unit delivering, filling prescriptions in Onoto Bay, in the town of Onoto Bay. I just want to give the details of the delivery of medication. So they will accompany teams, this is the NHF mobile unit, on the days and time as announced. Now, Enfield, Tuesdays, 9 a.m. to 12 noon. Dover, Thursdays, 9 a.m. to 12 noon. And Onoto Bay, Saturdays, 9 a.m. to 12 noon.
The quarantine communities in St. Mary are Dover, Enfield, and Onoto Bay. They have been placed under quarantine in an effort to control the spread of the coronavirus COVID-19. At last count, the parish had 18 confirmed cases. Jamaica's frontline workers have been working assiduously to ensure that all Jamaicans are protected from the coronavirus COVID-19. Among them, our nurses, considered among the best in the world. International Nurses Day is observed on May 12 each year to celebrate the birth anniversary of Jamaican nurse Florence Nightingale. The theme for International Nurses Day this year was Nursing the World to Health. Today, we highlight another group of frontline workers, specifically members of the Jamaica Constabulary Force, who took time out to honor our nurses.
Hi, I'm Inspector Sean J. Mitchell from the JCF's Corporate Communications Unit. And today we want to recognize our nurses as part of our frontline operatives in the COVID-19 fight, just by recognizing the efforts of our nurses and our partners in this pandemic.
Thank you very much.
May is Child's Month. It's also the month we celebrate Mother's Day. It's usually filled with fun activities within families, schools, and even on a national scale. But all that has been affected due to the new coronavirus pandemic. In this episode of Living Healthy, we look at the number of children who have contracted the virus and how new mothers can protect themselves and their newborns.
We know that the new coronavirus is highly contagious. Over 2 million people have been infected and thousands of people have died. In Jamaica, more than 500 people have contracted the virus. The Centers for Disease Control and Prevention says children do not appear to be at higher risk for contracting COVID-19 than adults. While some children and infants have been sick with COVID-19, adults make up most of the known cases to date. According to Chief Medical Officer in the Ministry of Health and Wellness, Dr. Jacqueline Bessesta McKenzie, so far, 58 of Jamaica's confirmed COVID-19 cases are children.
The majority of these children were asymptomatic. We had 13 children that were actually admitted to hospital. And of those 13, I believe we had 7 that were symptomatic, and these were with mild symptom, except for one case, the unfortunate case that we had of a child who did actually pass.
There have been reports of children being hospitalized in the United States with a rare inflammatory disease with symptoms including difficulty feeding infants who are too sick to drink fluids, severe abdominal pain, diarrhea and vomiting, change in skin color, becoming pale, patchy, and blue, trouble breathing, or they're breathing very quickly, racing of the heart, or chest pain, decreased amount or frequency of urine, lethargy, irritability, or confusion. Dr. Bessessa Mackenzie was asked about that at a digital press conference.
In this, fortunately, we have not yet had the experience that is now being revealed through the case studies that are happening out of the UK and in the US, where they are seeing you are having inflammatory disease in children that are affecting the blood vessels and causing some serious outcomes. We have not yet seen that. We continue to monitor closely our children that are in hospital and to do our surveillance, including the severe acute respiratory infection surveillance among our children.
A rash and swollen glands can also be signs, and if untreated, patients can suffer health failure. But those who are given medical care respond well. It's understandable for mothers to be concerned about breastfeeding in this COVID-19 era. The World Health Organization says if you're breastfeeding, wash your hands before touching your baby or wear a face mask. Here's more from WHO expert Dr. Pura Raiko Salon.
There's no evidence of transmission of COVID-19 through breast milk or breastfeeding. The live COVID-19 virus has not been isolated from breast milk in any mothers who are confirmed or suspected to have COVID-19. We know of 2 breast milk samples that have been positive by RT-PCR for COVID-19, and this means that we can see RNA particles in the breast milk, but these are not necessarily viable virus. So again, there is no live COVID-19 virus in breast milk or breastfeeding. There's no evidence of transmission through breast milk or breastfeeding. And the breast milk, as you know, and breastfeeding imparts numerous substantial health and development benefits for both the infant and the mother. Protect the baby through droplet transmission of transmission of COVID-19. The mother should frequently wash her hands with soap and water or alcohol-based hand rub. She should wear a medical mask, and this mask should be replaced once it's damp. It should be immediately disposed of. It should not be reused, and do not touch the front of the medical mask. Also, it's important when you're coughing or sneezing to cough and sneeze into a tissue, dispose of this tissue, wash your hands again, and also to clean and disinfect surfaces that you touch frequently. Yeah.
And that's the Living Health Report for this week. I'm Simone Absalom.
Time now for the business report with Gabriel Thompson.
In Tuesday's trading session, the JSE Combined Index advanced by 1,253 points to close at under 400,000 units. Overall market activity resulted from trading in 75 stocks, of which 41 advanced, 26 declined, and 8 traded firm. The Junior Market Index advanced by 45 points to close at under 3,000 units. Stocks advanced for 138 Student Living Jamaica, AMG Packaging and Paper, and Blue Power Group. Stocks declined for Barita Investments, Caribbean Producers Jamaica, and Carreras Limited. Trading firm were 1834 Investments Limited, Caribbean Assurance Brokers Limited, and Siboney Group Limited. Trans-Jamaican Highway Limited was the volume leader with 4.9 million units, followed by Mailpack Group Limited with 2.4 million units and Sagicor Select Funds Limited Financial with over 1.6 million units. Now for the foreign exchange. The US dollar on Tuesday, May 12 ended trading at $146.87. The Canadian dollar sold for an average $105.84. The pound sterling traded for $178.71, and the euro ended trading at $162.12. Oil prices edged higher on Wednesday, reversing earlier losses, and Brent held near $30 a barrel as potential OPEC plans to deepen supply cuts were tempered by demand concerns exacerbated by a possible second wave of coronavirus infections as countries ease their lockdowns. Brent crude futures climbed 17 cents to $30.15 a barrel. West Texas Intermediate crude gained 13 cents to $25.91 a barrel. And that's it for the business report on PBCJ. I'm Gabrielle Thompson.
In regional news, we begin in Guyana, where the ongoing national recount of the March 2 general and regional polls has unearthed a series of irregularities. Alexis Rodney of InfoHub reports.
The search for transparency in the March 2 polls is widening. Over the last week, counting agents have been unearthing numerous irregularities during the recount process. With over 200 ballot boxes recounted so far, and more than 2,000 yet to be reviewed, APNU AFC coalition officials said there is no telling how far these irregularities will go. The first day of the recount, agents were reporting cases of the names of deceased persons and those who have migrated turning up to vote. In other instances, the number of ballots in the box outnumbered the names of persons struck off from the list of voters. There are other instances where the number of persons voting by affidavits is more than the number of affidavits provided at the polling station. The coalition believes that these discrepancies will play an integral part in the final analysis.
There are questions with respect to whether people who are dead voted and people who are not around voted as well. So even if you were to say, okay, 10 for you, 15 for me, how credible is that 10 or how credible is that 15? Is this a true reflection of the will of the Guyanese people? And that is the ultimate question that has to be answered. What has happened to the will of the Guyanese people? And this recount will decide that matter.
That was former Director General of the Ministry of the Presidency, Joseph Harmon. He said the APNU AFC coalition counting agents underwent extensive training to decode the very discrepancies being unearthed. Minister of Public Security Kamaraj Ramjatan has reported similar scenarios. He said the truth of all that transpired on March 2 will be revealed after this important recount.
But a better assessment will be known at the very end of the process when the 339 box is then made transparent for us to see what transpired in all those boxes.
So are you holding your judgment in abeyance?
Oh yeah, you have to be very cautious.
We've seen being used a lot. Are you holding it in abeyance?
My judgment is going to be made because it's not only 80 boxes we're going to make a determination on. It will be the 2,339 boxes. Okay? And we should be very patient with the process so that we can know what happened in all those boxes. And then we're going to make an assessment, as GCOM will, as the observers will, as the other political parties and stakeholders will.
The opposition has been going at length to downplay the current structure of the recount process. They claim that the constant objections and queries by agents are delaying the process. Some players believe that the opposition must have something to hide to be making such baseless claims. Government Commissioner Vincent Alexander said the search for transparency must be thorough. He said the commission is going all out to ensure that the exercise of March 2 was fair, credible, and transparent. For InfoHub, Alexis Rodney.
Trinidad and Tobago's government is considering whether the wearing of face masks should be made law. The health minister says the Attorney General is currently giving the matter some consideration. He addressed the topic at the Ministry of Health's virtual media conference. TTT's Karen Cozier-Phillips reports.
Speaking on Tuesday at the virtual media conference on the COVID-19 pandemic, Minister of Health Terence D'Alsing said new requirements are being drafted.
So the Attorney General is looking at whether wearing of masks can in fact be a law or be a part of the regulations.
The health minister said he and other public officials on Monday visited parts of downtown Port of Spain following the easing of food vending restrictions. He said he was disturbed to find not all businesses were adhering to protocols intended to slow the spread of the virus.
I saw the excellent, the so-so, and the ugly. One establishment had everything that you could ask for. And then you walk down a few yards, they had nothing.
Minister D'Alsing said currently there is no legislation that requires vendors to wear face masks, but it is a public health recommendation that's necessary. He said additions to existing regulations are also to be expected.
We are now going to come up with some minimum requirements which we will go to the Attorney General with to put into the regulations as to how persons who operate food establishments should protect not only themselves but their customers.
The health minister again urged members of the public to observe all public health measures. Karen Cozier-Phillips, TTT News.
In sports, there are plans to stage the Jamaica International Invitational meet in early September. The meet, which is classified as a silver event in the World Athletics Continental Tour Series, was originally set for May 2, but was postponed in March in light of the COVID-19 pandemic. Jamaica Athletics Administration Association President Dr. Warren Blake says the staging of this year's Jamaica International Invitational remains on the agenda. The event is scheduled to make a return after a one-year absence, as last year's edition was cancelled due to insufficient funding. West Indies cricketer Gayle will likely be penalised by the Caribbean Premier League CPL for his public tirade against his former Jamaica Talawa franchise and its assistant coach, Ramnaresh Sarwan. That's the word from Cricket West Indies boss Ricky Skerritt. Although describing the controversy as interpersonal battles being fought in the public eye, Skerritt said Gayle, who has been signed to St. Lucia Zouks for the 2020 season, had brought the CPL into disrepute. Gayle was highly critical of Sarwan, his former West Indies teammate, and the Talawa's management in a series of videos posted on his YouTube channel late last month. And that's our news and sports package right here on PBCJ. Join us again tomorrow, same time, same place for more news and sports.